This is a video, you guys might know Heather Anthony, and she wanted everybody to see this as well. So this is Heather before we started. You see the hollowing in her temples. She's got a beautiful bone structure. She's a gorgeous girl. She's just starting to see those signs of aging. So here we are injecting into Heather's temples. It is not a terrible procedure. I think that Heather is very tough, but we do numb with lidocaine first, topically. You see where I'm pointing out here, this is an area right around the nose that you start to lose some of the bone as you age. That's one of the reasons why the nose starts to look bigger as you age. And the upper lip lengthens and flattens when you age. And so a lot of people try to fix that by just filling the lip itself. But if you fill in that area around there, you actually get a lifting up of that upper lip, and you see more of the lip, but it's still very natural. So that's what we're showing on Heather there. Then we're also looking at kind of the hollows on her cheeks as well. We do a lot of massaging with Sculptra. It's important to massage after the procedure itself too. It's the rule of 5. So you massage 5 times a day, 5 minutes a time for 5 days. And that really stimulates that collagen to kick in and form around the little nodules. So I'm doing some massaging there. We filled a little bit right along her earliest jowl there. So this is a left-right comparison. That's with one vial on the left with Heather. So you can see her temples are filled back out. She's got nice cheekbones here. That earliest jowl is gone. That's the right side before treatment, where you see that the temple is still left. You still got some hollowing, and that's your left-right comparison for her. So Heather's gonna come back in a couple of weeks, and we're gonna do round 2, and then we'll do round 3. And what we expect at the end of that is for her to look like that left side did after treatment. This is Ashley Moss, who has a nice bone structure, but has just lost a lot. And this is someone whose temples are just crying for Sculptra. It's like, please fill me up. We did 3 vials the first day, so you could really see about what a vial and a half would look like on one side for her. So, same injection principle, whereas Ashley here she needed a lot in her temples. So we spent a lot more time on her temples, and then as we go along with the procedure, she may not need as much the next time, and we'll focus more on the lower half of her face as well. But you can kind of see what the procedure involves. It's not a cookie cutter, one size fits all. There's a lot of art that goes into finding what you need where. And during consultation, we could talk about specifically what that is. She probably could use a little bit more in her temples there, but this is getting a nice fill. She looks much more youthful on the left. This picture, we had another picture in her chart from about 5 years ago, and that's really kind of where she was then. So let me show you that still frame so you can kind of see her left and right. So this is immediately after. So what you're seeing there is not her end result of Sculptra. That is the actual Sculptra sitting in the skin right at that moment. And all of that fluid will go away over the next couple of days. So if you see her today, she's not gonna look like that. She's gonna have all of that fluid's gonna be gone, but in 4 or 5 months from now, she should be where she was at the end point there.